So here's a bit of an update. So because I haven't been able to use my feeding tube because it's not operational due to refusal of service from a major hospital, I've had no choice but to eat a little bit. And what that's done is I've aspirated into my lungs what it was that I tried to eat. So now I have a chest infection, and the chest infections have been continuous since I was refused service with my feeding tube. When I have my J tube, I don't have these chest infections, and so what that means for me is with a non-operational J tube, I have chest infections. We are only treating the worst of the worst chest infections, so it means that I'm running a temperature most of the time and feeling pretty down. I feel pretty sick, obviously. For the last few nights I haven't been able to sleep properly due to just not being able to get enough oxygen properly, turning ugly colours as I do. As people who know me know, I turn blue and don't do real well. I haven't been able to sleep, so that's been for the last 2 nights, and there's basically no point in going to a hospital since they can't do anything anyways, and even if they could do anything, they're just choosing not to, because obviously they just don't want to, because Professor Hebbard wrote that wonderful note to say not to do anything about it. And one of the more concerning factors is that with fibrosia, ossification or progressiva, we do not have good and healthy lungs. We are born with lungs that do not have the capacity of a regular person. So when you take into account consistent chest infections due to aspiration, which is continually damaging my lungs, what you then have is a really bad situation when you don't have correct lung capacity because you were born without that due to your genetic condition. So for me, what that means is when they took a chest x-ray recently, they were shocked to discover I have 2 very underdeveloped and small lungs to begin with. And then the Royal Melbourne Hospital believes it's in my best interests with small, underdeveloped lungs to continuously have chest infections. The whole state of Victoria seems to think that it's in my best interests. Well, let me tell you something. You starve of oxygen, you turn blue, you turn ugly colours. But again, what's the point of going to a hospital? Because the Royal Melbourne has spoken, and they're not, nothing can be overturned or fixed, So I'm pretty upset, actually, because I don't have the lung capacity like a regular person. There's no point in going to a hospital because they won't listen to anything I have to say, despite documentation, reports from x-rays. They're just continually damaging my lungs. So now I face a situation where I'm somewhat like someone with cystic fibrosis. So anyone who has cystic fibrosis can appreciate the processes inside of my lungs and what that feels like, and the fact that it's a very bad situation when you have a defective heart and lungs like someone with cystic fibrosis. The two combine to make a situation where it's very hard to, physically walk and physically do the necessary day-to-day tasks because of the breathing. And all this is avoidable. It's different if you can't avoid it, and there is no known treatment, and there is nothing you can do about it. But when there is a treatment, and there is a way to manage it, it's called a J tube, then, it should be done. It really just should be done.